following on your sheet, I think we're on page 4. Moving on to the MCP joint. We're going to start with flexion and extension. Patient position is going to be seated. You're going to still have the arm supported by the table, but now it doesn't need to be up at 90-90. We're going to position the radial ulnar joint in neutral. And again, the wrist and forearm are going to be fully supported by the table. So that it's easier to see, I'm just going to do her second MCP, since that's upward. A couple of options, and you have a few different goniometers you can use here. Anybody have another one of these?
Yeah, we do.
Small one?
That's the same size.
Same size?
Yeah.
Same.
There was.
There was some teenier.
Okay, I'll use this one.
It's the same size. That's small.
A couple of options to do MCP flexion. First of all, when we are moving the finger through the range, it's important to stabilize on the second metacarpal. No longer stabilizing on the wrist, because then we can get excessive motion. Stabilize the metacarpal, grasp the proximal phalanx, take your patient through the full range of motion, assessing end feel and asking about symptoms. Any pain with that? Yep. We have at least 90 degrees there. So I can set a small finger goni, or I can set one of the metal finger gonies. These are outstanding. Try them at some point today, please. Take my patient back through the range of motion. Once I get there, I'm going to stabilize her. Apply my goniometer. Still no symptoms? Can I hold you there another minute?
Yep.
Good. We have 104 degrees. Or we could use the metal goni for that same measurement. And relax. And this one gave us 105.
Where's your stabilization?
100, I think, is normal. Stabilization is going to be on 90, it says?
Mm-hmm.
Okay. Stabilization is going to be on the second metacarpal. Two options for extension. Either you can position on the dorsum this small goni. Got to use these if we're going to do it this way, that have the smooth circular side. Take the patient through the full range of motion. Have maybe 60 degrees there. Firm end feel. Any pain? Good. So I can either Nicole has extra motion. Place it on the dorsum of her hand, lined up with the dorsal aspect of the second metacarpal, the second MCP joint, and the second proximal phalanx. Rotate her hand so you guys can see.
So you don't have to stabilize it?
Right
You're
here.
just putting, oh, okay.
So I stabilized you through the range, I put you back there, and then I'm holding that stabilization as best as I can. Or, your book also offers a second method where you can apply this to the palm of the hand. However, if you do that, you use either this one or this one. If you do that, the finger must stay straight. So in order to keep the finger straight, it's okay to gently flex the wrist some in order to avoid any passive insufficiency of that musculature.
Isn't that cheating? Because
Ow,
I
that
can't go as far with my finger straight, I don't think.
Again, that's why we'd have to flex the wrist.
Wow.
The book offers two options. You can use either one. That's the MCP flexion and extension. You guys with me? Okay. PIP is identical to the MCP. You can take your patient through the range. We have over 100 degrees there. A firm end feel. Any pain with that?
No.
Might even be a hard end feel. I don't know if I'm getting any give.
Are you stabilizing at the base
Stabilizing
of
the
that?
proximal phalanx, moving the middle phalanx.
Okay.
After you've assessed your end feel, you're going to hold that position. And again, you can either use the small finger goni that's plastic, and we have 119 degrees, or you can use the metal goni. Either option is okay. I think we have 120 degrees.
100.
So she's got hypermobile hands. Not as mobile as Oleg's though.
I can imagine. That was probably 150.
He had some extension in all these too. So her extension is 0. We can visualize that it's 0. However, if there were hyperextension at the PIP, you could measure it with this small goni. There. But Nicole doesn't have any, so there's nothing to measure. DIP is also identical. We take it through the range. There's maybe 90 degrees there, firm end feel. Can align either one of our gonies. Any discomfort with that the first time? Take her back through the range. And we have maybe 105. Extension is the same.
90.
Hypermobile hands. Nicole has almost no extension there, but we could measure that the same. Questions about MCP, PIP, or DIP flexion extension?
Where'd you stabilize? The middle?
Middle phalanx to do the DIP.
And
Proximal phalanx to do the PIP. Always stabilizing one segment proximal to where we're going here in the hand.
When you do the, does her finger have to stay,
When I do which one?
let's say the PIP,
Mm-hmm.
the rest of her finger has to stay straight, or can it also?
Okay, good question. When I do PIP flexion?
Yeah.
If you actively flex your PIP joint, you're going to see that your DIP flexes as well, for most everybody, unless you try really hard to keep the DIP straight. Generally, it's going to flex, correct?
Mm-hmm.
Passively, if you are properly ranging your patient and they're properly relaxing, that DIP should not bend.
Come into play.
And if anything, as you flex the PIP, the DIP will extend. And as you extend the PIP, the DIP may flex a little bit because of passive insufficiency of the flexors and extensors.
Yeah, you're right. You can,
If anything. So if you notice that as you flex your patient's MCP, the finger curls, or as you flex the PIP, the DIP flexes, your patient's not relaxing.
okay.
Good question. Any others?
And you don't actively try to extend, you just let them naturally.
It's an immeasurable amount right there. I'm not going to push it as hard as you did. We have maybe 5 degrees, 10 degrees. I'm not cranking on anybody's fingers.
Just wondering if we're supposed to actively or just let them do what they can.
Nope, passive. Always
Or what
passive.
they can do.
Nope, what I can do
Oh yeah,
to you.
what you can do. Okay.
All right, you have 10 minutes through the